she doesn't need surgery. She didn't need it, but she wanted it. So to take you back, give you a little bit of history, this is surgery number 4 for her. She's had leg lipo to these areas, fat correcting 4 times already, and still couldn't achieve what she wanted. So if we go from here, here's the before. Here's the one day after, same day, not even 24 hours after. This is probably 18 hours after, maybe, if that. 12, yeah, maybe 18 hours after. So let me explain this to you. So let's learn a little bit right now. So what we see here on her before, off the bat, we see some cellulite. Cellulite can be 2 things. It can be bands and it can be laxity. Right here, these are cellulite bands, right there. But this is laxity right here, those waves. So we had to do a spiral thigh lift. We did some leg lipo, internal heating to all these areas. We did lipo all the way through here, Renuvion, to tighten her skin. We did some fat grinding to ovule. You can see the dimples right here, and right here. This is where we went in there with our ovule and cut the bands of cellulite. And then it popped them loose and we filled it with fat right there. We also did a little bit of fat grafting to her hip dips right here. In an athletic woman, you typically don't want her to be super curvy right here. This is a more athletic shaping, which is more of like what we call a skinny BBL. So what is a spiral thigh lift, guys? All right, a spiral thigh lift is going to go right through here. It's going to go through here. It's going to extend and come up to the front in the bikini line right there. So this is a hidden scar. After it heals, you can hardly see it right now. It's in the crease. So right now, all you really see is the steri strips, which is really good. Part of what we did for that is to pull the leg up and to correct the buttock crease right here. So you see right here, it's very flat across. And now, look, it curves up. It's more happy. It's a smiley face. That's what you want right here. So you're like, oh, you guys didn't remove much skin. She didn't look like she had loose skin. Let me show you how much she had. So if you look right here, look at this. This came out of the back side. That's 1 from each side. That's a huge amount of laxity, guys. Someone at first glance might not look like they need it, but then they'll be like, okay, you might actually need it. Misconception yesterday on the lives, on the post. Lots of comments that I want to address for you guys. People said, go to the gym, do some squats, change your diet. You know what? That's not going to help your loose skin, no matter how much you try. It might actually create even more loose skin because you'll lose more weight. So let's have her turn to the side a little bit. Can you turn to the side? Turn a little bit more? Great. Okay, so right here is where we're really going to see a big difference right here. Let me show you the side profile. So what we saw right here on the side, you guys might not have saw it from the other angle, but look right here. So right here we saw previous liposuctions, they dropped her butt. It fell down right here. See it? It's hanging down. It's created this fold right there. She did not like that. Everything's kind of falling down. So right here with the spiral thigh, we'll be able to make it lift up. So right here it goes in just like this. Before it went down. It was hanging like a wet diaper. We don't want that. Nobody wants to walk around with a wet diaper, guys. So we'll have her turn a little bit more. Let me show you the front. Let me explain to you how the spiral thigh lift affects the front of body contouring. All right, so the scar right here is very thin. Lex, come up close, show this. Look how thin that line is right here. That's a very fine line. As soon as that heals, lasers, skincare, it's all gonna fade. And then we can make that fade pretty quickly. About 3 weeks after surgery, we can start doing lasers. Immediately after, she's applying skincare on top of here, which is going to saturate through there and go to the scars. All right, so from the front, what do we notice here? Anyone want to take a guess? Thigh gap. Right there, look at this. So right here, look, touching. And through the lipo and the spiral thigh lift, it widened her thigh gap just like that. This is like a magic trick, guys. Nobody can do this very well. And if you overdo this, the legs start to drop and it sags even more. So we'll come from the top and work our way to the bottom and show you the little moves that are the finesse of female leg lipo. So we come through here. You guys look, it's much more tighter through here. I don't have gloves on or else I'd pinch your skin. Do you want to pinch your skin right here and show us how tight it is? Can you pinch your thighs? See? Look how tight that is, guys. Look at that. It's very tight. So through there, a lot of laxity. So we made it very tight, very sculpted. And then if we come down here, look, this is an area that most doctors don't do because it's very complex. So if you look right here on her knees, this is the one area. This is why she's done 4 surgeries, is to really correct a lot of this. So right here you have these fat pockets right here. You have to go around here. It's very meticulous to bring these down and make it more slim and around the knee. So look now. Look at that. Very swollen here still, but you can see a really big reduction. So take a look at this. right into there, guys. It is all about the details in these surgeries. This is a very detailed procedure. It's not just, oh, let's go take off some fat and give her some Renuvion. No, it's a completely artistic and detailed procedure. Any questions, Lex? What are people asking? What are they saying? Anything nice? Anything not nice?
When can she go back to the gym? How long is...
So we usually tell patients 3 weeks for skin removal. You might be clear at 2 weeks depending on your healing, but 3 weeks, you're definitely good. And right now she's walking, there's no wheelchair, any of that. She walked in here, probably walked out of the OR last night. And everything's fine. She's walking, doing fine. There's really no issue. It's actually good to have some movement for blood circulation.
Someone wants to know, how long will the scars be visible for?
So everyone's going to be different. That's going to depend on how your body heals, lots of things, how soon you're doing lasers, how diligent you are with your Emer skin routine. I would say 3 weeks, you can start doing lasers. Give it a few months, they start fading, and about a year or so, if you're really diligent, you won't even see them. So if you're committed to the protocol, we'll be committed with you and get those scars gone. So don't worry about that. Let's focus on the contouring, the result, and we have great surgeons who do great suturing. That's how you have a great surgeon, when their suturing is great. That's how you judge someone. Any other questions?
What is she doing as far as aftercare?
Aftercare. Let's have her turn around. I'll show you the back while I talk about aftercare so the new viewers can see it. Aftercare, guys, is 4 things that we really do here. 1, lymphatic massage. 2, hyperbaric oxygen chamber. 3, IV therapy. And 4, peptides. The peptides are going to help her skin tighten, expedite recovery, and we can even put them in the IVs here. So those are the things that we suggest for recovery. Anything else?
All right.
For our new viewers, here's our before on the backside. Spiral thigh lift, high definition, female leg lipo, Renuvion, internal heating, Ovally, the gold standard. Before and after, all right? We're tighter, we don't have the cellulite anymore. The buttock now curves up. And we widen the thigh gap, guys. She looks phenomenal. All right, so we're gonna show you her today, day 1, not even day 1, 18 hours after surgery, and we're going to show her through the next week, and her 2 weeks until she heals, and long-term results. Bye, guys.